Every week we continue to update our statewide COVID risk map to highlight which communities are seeing a higher number of cases based on their population. And for folks in those communities, it's really important that you remember to be vigilant and to pay attention to the public health guidance provided by the Commonwealth to stop the spread of COVID-19, as well as the messaging and the programming that's coming from your municipal officials, and that we all work together to continue to do all we can in those communities to support their efforts to balance their efforts with ours to manage the spread. Our community enforcement and intervention team continues to work with those higher risk communities, and for cities and towns that shift from one category to another, our administration's urging them not to change course on major decisions like schools right away. Sometimes communities bump up for one very particular reason. Sometimes it's because there was a brief outbreak in a nursing home. Sometimes it has something to do with a particular event or circumstance, private gathering of some kind. Communities will bounce as a result of that one initiative up. Contact tracing will identify it, people will isolate and quarantine the folks that were involved, and then the community comes back down, which is why our guidance from the beginning has been that people need to look at 3 weeks worth of data. Those 3 weeks worth of data represent 4 weeks and can establish a trend. People shouldn't be making decisions on this stuff based on 1 week. We don't parse the data. We just put the numbers out as they are, and then we work with our colleagues in local government to make decisions and determinations with respect to what it is that creates the bump up or the bump down. And if you look at the data week over week over week, there are a lot of communities that bounce around. There are many that have literally been below 5 per 100,000 or below 5 period since we started putting this map out back in the beginning of August. But there are communities that bounce up and bounce down, and in many cases it's because of a single event or a single institution that creates that, and that's why we think it's really important for people to look for trends. And trends don't happen in 7 days. Trends happen over the course of 3 weeks worth of reporting, which represents 4 weeks worth of data. Now, getting kids back to the classroom, obviously, is something that we believe is critically important to our success and to our kids' success going forward. And it's very important for people in communities to look at 3 weeks worth of data, which is 4 weeks worth of information, before they make decisions about changing their plans with respect to schools. Today we're pleased to announce a $650,000 grant program for organizations serving black and brown people in hard-hit cities and towns like this one, and that will include all of the high-risk communities, but also will be available in communities that have substantial populations of people of color. The funding will support public awareness efforts and targeted community interventions, and it will be done in coordination with our community intervention teams. These funds will be used to remind people about mask wearing, social distancing, and other steps that they can take in their community to help stop the spread. And it will also support training and messaging on COVID-19 prevention for people who provide in-home services like meals assistance and wellness checks. We're also working with the Health Resources in Action community to implement this program, and today the application for this grant program will be posted on hria.org/MA-COVID community grants. We look forward to partnering with these community organizations to stop the spread in our highest risk communities. We've also talked a lot about communities that have seen higher rates of COVID to promote public health, but it's also important to talk about communities where there is little or no COVID for weeks. Residents and community leaders that have little or no COVID in their communities have a different set of circumstances. They're able to make certain safe decisions for their families, such as getting kids back to school. Since we launched the COVID risk map at the beginning of August, we've seen the vast majority of Massachusetts towns are in lower risk categories, so-called gray and green. And which means there's little to no transmission of COVID-19 in those communities. The guidance for the medical and public health experts is clear for these communities. It's safe to return students to in-class learning. This guidance was developed and endorsed by the Massachusetts Academy of Pediatrics and the Massachusetts Public Health Association. And we're glad to see that most of these districts are following the science and are implementing either an in-person or hybrid model. However, there are 16 districts across the Commonwealth where the public health data supports a return to in-person learning, but where officials instead opted for a remote-only education model. Remote-only models should only be used for communities with 3 consistent weeks of red designations, unless there are extenuating circumstances. Last week, the Department of Elementary and Secondary Education reached out to these communities and asked them to provide a timeline by which they will return to in-person learning. Districts must provide this timeline within 10 days, and depending on the response provided by the district, the department has the option of pursuing an audit. Local officials run their local schools. We understand that, but the state has an obligation to ensure that local officials are providing the best possible education in these difficult circumstances to kids in their communities. Commissioner Riley and our administration has been and will continue to help in every way possible to get kids back into the classrooms. The progress in our public health metrics has also driven our ability to safely reopen our economy. When we introduced our reopening plan in mid-May, the statewide positive test rate for COVID-19 was around 10%. As more industries have opened up, we've seen a decline in the positive test rate, which, as I said earlier in my remarks, has been below 1% now for several weeks. The people of Massachusetts and the folks that worked on that reopening team, kudos to you, Lieutenant Governor, for co-chairing it, deserve enormous credit for the success of this initiative. Almost 500,000 people have gone back to work since that reopening process began. And as I said previously, over that period of time, unlike what we saw in many other states, our positive test rate here in Massachusetts continued to drop throughout that period. I also want to thank all of the businesses and their workers who have aggressively adhered to the health and safety protocols that have been part of this reopening plan. By responsibly reopening, we've avoided the spikes in new cases, and people have been able to get back to work. And we're constantly consulting public health leaders and industry experts about ways that we can modify these regulations given these low rates of COVID positive tests. And yesterday we posted several updates on reopening rules that will go into effect next Monday, September 28th. Restaurants will now be able to, when this goes into effect, restaurants will be able to seat 10 people to a table, which is up from a previous limit of 6, and that update will apply to indoor and outdoor events. We also want to help restaurants use their spaces more effectively. While bars remain closed in Massachusetts, restaurants with bar seating may now use those spaces for food service with the right distance measures in place.
Yes.
No standing around the bar, okay? Bars are closed, nightclubs are closed, but the evidence from other states with respect to this issue is clear. Restaurants can use bar seating for regular food service with appropriate distance in place. COVID's still with us, and until there's a medical breakthrough like a vaccine, we have to do all we can, working with our colleagues in the food service business, to keep our restaurants and our other businesses safe. We hope these updates will also help Main Street shops and restaurants.